Hi, good afternoon, and thank you for joining us today. My name's Ruth, and I'm the marketing manager here at Kimal. We're pleased to have you with us on this first webinar in our series. Some of you will know Kimal as a producer of specialty procedure packs for the fields of cardiology or radiology. Well, CIED implantation is just one of the procedures that we support. We're also delighted to be working with an innovative product solution called ToraPace. And ToraPace is a solution for the prevention of CIED infection. Joining us today is Benita Baldolf, and Benito is a consultant cardiologist who's been working with ToraPace extensively in the field for a number of years. Today, Benito will share some of his work around CIED infection and ToraPace as well. We will be taking questions throughout the webinar. We'll answer them with a live Q&A at the end. And on the screen below, you have a question box where you could submit your questions. We'll endeavour to answer as many as we can, but any we don't manage to answer today, we will respond to you all directly after the webinar has finished. So without further ado, Benito, I'll hand over to you.
Well, thank you, Ruth. I'm honored to be talking about ToraPace, a promising solution. These are my disclosures. I have to admit I'm a true enthusiast for ToraPace and the use of ToraPace in the prevention of CIED infections. Well, ToraPace is a solution designed to prevent actually CIED infection. As we can see here, classical picture of a lead protruding the skin in case of an infection. Sometimes you see these, sometimes you don't even see anything, and there's an infection going on. So we're going to be talking about the scope of the problem today. As we all are familiar with, CIED-related surgery procedures and the rates are rising. At the same time, CIED infection rates are rising disproportionately. And I'm referring to literature here that you're all familiar with. They've been looking into the time frame from 1993 through 2008 and noticed an increase of CIED-related surgery procedures of almost 100%. At the same time, the rate of infection regarding or related to CIEDs were 210%, so 4 times as many infections. A real jump was through 2004 all the way to 2008. What are the reasons for rising CIED infection rates? Well, patients, on the one hand, are older. When they're older, obviously, they display more comorbidities. When they're living longer with their CIED, more box exchanges need to be conducted. We have a lot more complex devices, which are in general heavier and bulkier than just primary pacemakers. They come with more leads. Therefore, they display a longer duration of procedure. We can also see a shift from operational theater to catheter laboratory. And this is due to us cardiologists or EPs conducting these surgical procedures rather than cardiac surgeons or rhythm surgeons. And I suspect a shift in antibiotic resistance in endemic species. Here you can see a chart referring to the reasons for CIED infections and the pathogens underlying. And we can learn that approximately 70% of CIED infections are due to Coagulus negative Staphylococci and Staphylococcus aureus. This is data from 2016, and we can just now see a new literature regarding the microbiology of CIED infection from 2021, looking into the rapid data, and they show this exact same picture. When we look into the risk-adjusted mortality rates of CIED infection, we can learn that it does not matter which CIED is infected, we are always looking into a higher rate of mortality when a CIED is infected, obviously. When we're looking into these Kaplan-Meier graphs, we can see that there's a clear and a significant difference in survival with and without infection. There's a real jump in the first quartiles, and then it's basically linear in both graphs. And this does not matter which CIED is infected, but it goes for all of the CIEDs. I'm presenting to you some own data we're looking into right now. This is reimbursement data of the biggest health insurance company in Germany. And we're looking at a CIED infection rate in Germany right now in the years 2015 through 2019. And the reimbursement data is referring only to hospital admission due to CIED infection and consecutive device removal or revision. And if we look just into these kind of reimbursement data, we learn that in Germany, we have 1.9% CIED infection rate per year. And if we look into cases reimbursed, it's 3.2% of the cases reimbursed every year for admission due to CIED infection. These are huge numbers. Also, if we look into additional procedures related to infection, we learned that it's 2.23 additional procedures when looking into CIED infection, whereas in general CIED-related surgery procedures, it's 1.2. So it's almost double the procedures in case of CIED infection. When we look into CIED-related infective endocarditis, mainly and broadly coming from bacteremia or septic patients, we see that it's 0.7% annual rate of CIED-related infective endocarditis. When we look into the mortality rate in Germany right now, we learn that general mortality rate is 11.3 per 1,000. When carrying a CIED, already the general mortality rate is 12.1. And in case of CIED infection, this rises to 84.1. In case of CIED-related endocarditis, it's 152.4 per 1,000. And this is huge numbers again. What can we learn about CIED infection-related morbidity? This is best gleaned from more hospital admissions in the first year after any CIED-related infection, and a longer hospital stay whenever a CIED infection is apparent. The risk-adjusted length of stay for CIED infection in the UK is 17 to 22 days, and in Germany it's 15 to 31 days. So clearly, more hospital admissions, a longer hospital stay in case of CIED infection occurring. CIED infections are really a burden for resource, finance, and trust. They display a substantial healthcare resource utilization, and we have to be clear that we are constantly under surveillance. Performance criteria, quality management-wise, everything, both on the internet and the intranet. The cost related to a CIED infection, for example, in the US, ranges from $28,000 to $53,000. In the UK, on the outpatient basis, it's £5,000 up to £24,000 when inside the hospital, when treated in the hospital. In Germany, this is 12,000 euros to almost 60,000 euros. So the cost in Germany can be reimbursed, then it's paid by the public, or when readmitted to the same hospital, the facility has to pay for it. In the UK, more infections lead to less reimbursement for all cases in one center. And in the US, again, the facility has to pay for an infection when a patient is readmitted to the hospital for reason of CIED infection. So clearly there's a need to prevent CIED infection in the first place. From this data, we can learn that this relates also to the expertise within a center. When a center is conducting many CIED-related surgery procedures, they have, in general, and this is clean from the data, a lower infection rate. And when a lower infection rate occurs in these centers, also swift extraction leads to less cost in these centers. So they not only have a lower rate of infection, but also following the guidelines and swift extraction instead of long revision procedures and prolonged antibiotic treatment are leading to less costs in these centers. Whereas smaller centers, and this is only general data, so there might be smaller centers, and there are many smaller centers that have high expertise and low rate of infection, obviously. But when we look into general data, we learn that smaller centers with less expertise are looking into higher figures of CIED infection. And when a CIED infection occurs, the cost related to the CIED infection and the resource burden is in general a lot higher. So here's a list of odds ratios for developing a CIED infection related to host and to the procedure. When we look into the procedures, early reintervention clearly has a high odds ratio for developing a CIED infection. High power devices versus lower power devices, displaying more leads in place. This is longer procedure time, device replacement or revision due to malfunctioning leads, for example, and temporary pacing have a higher odds ratio for developing a CIED infection. When we look into medication, obviously immunosuppressant medication has a higher risk for CIED infection or carries a higher risk for CIED infection. The same goes for oral anticoagulation, and I suspect also dual antiplatelet will do the same. When we look into host-related risk factors, dialysis dependency, renal failure, fever within 24 hours prior to implantation, renal insufficiency in general, diabetes, congestive heart failure, male gender, and this list also is a little longer, including COPD, malignancy, skin disorders, and there's a couple more that display a higher risk for CIED infection in the first place. So for knowing what patients we're dealing with, this list is really great to give you an idea where and when to use preventive measures or to be really careful when conducting surgical procedures related to any CIED. The hazard ratio for mortality with a CIED infection is really higher when it comes to prescription of immunosuppressant medication like corticosteroids. When we're looking into host-related characteristics, systemic embolization, most likely displaying endocarditis, abnormal right ventricle function, abnormal renal function, and heart failure and acute renal failure associated with a higher rate of mortality when CIED infection is present. So what is currently recommended and what is used inside the pocket? So recommendation to use anything inside the pocket, clearly no recommendation, other than the Tyrix antibiotic envelope in high-risk patients. Clearly, there's no recommendation for use of antibiotic solution, as we've learned in the big randomized trial, including almost 20,000 patients, the PADET trial in 2018. There's no recommendation for PVP iodine, which has been looked into by Lacchiretti in 2005, although we have some data in other sceneries like operational theaters concerning orthopedics, and periprosthetic joints. There's some data for it and some against it. However, in the CIED setting, no recommendation for PVP iodine. Ethanol supports the formation of biofilm in endemic species like Staph aureus, so clearly no recommendation for ethanol. I'm naming this because I know of centers that are using ethanol inside the pocket. Then hydrogen peroxide, there's data supporting. This is small and retrospective data, but they've seen a significant impact of using hydrogen peroxide inside the pocket, but there's no recommendation for it. There's no data for sodium hypochlorite. There's data not supporting polyhexanate inside the pocket, and there's no recommendation for this. For octinidin, it's obsolete because it induces tissue necrosis inside deep tissue wounds. As I said before, there's a recommendation in high-risk patients for Tyrix, an antibiotic envelope. And we have Toropase, a CE-certified medical product for the use in any related surgery procedure in any CIED marketed today. It has been CE certified and is safe to use on any CIED. Let's talk a little bit about the Toropase, a promising solution to prevention of CIED infection. It prevents bacterial and fungal adhesion to the foreign body. It has physical-chemical properties that directly destruct the pathogen. And at the same time, it isolates and neutralizes endotoxins exotoxins released throughout this process. And it's highly effective against gram-positive, including ORSA and MRSA, gram-negative, including Pseudomonas aeruginosa and Stenotrophomonas maltophilia, which are not that common in CIED infection, obviously. And this also includes coagulus-negative staphylococci and vancomycin-resistant enterococci. So it is broad spectrum. At the same time, it does not display any tissue toxicity and no organ toxicity. It is ultimately absorbed after degradation into an amino acid, so it's an amino acid compound, and it creates a favorable pH range inside the CIED pocket to prevent CIED infection in the longer course. And I think a big advantage for Toropase is also it's a liquid and it gets everywhere. So it treats the CIED and it treats the leads, the suture, the fixing sleeves, the sheath, everything. Here you can see the endemic species and Toropase in degradation, in log degradation of colony-forming units. And it's really active against all endemic species in CIED infection, including fungi. Very important. Well, thank you for having me and sharing this information regarding Toropase. We will be addressing further issues and key strategic points in the newer webinars to come. Well, thank you, Ruth, for having me, and let's get to the questions. There's some.
Yeah, there are some. Thank you, Benito. I think you did cover this in the slide, but perhaps just to reiterate, the first question is, with which CIED can you use Toropase?
Well, there's two sides to this question, obviously, because as I said before, you can use it in any CIED marketed today. It covers all all silicons, all the materials used within any CIED. But the other side to it is that we've been using it, obviously, in high-risk procedures early in the days. But we soon learned that prevention of CIED infection is cost-effective itself. And we calculated the cost-effectiveness by preventing a single infection, and we learned that we could use it in any patient. Since it does not harm the patients, we're now using it in any patients since December 2019. And before that, we used it in high-risk patients. But you never know which patient will be experiencing CIED infection. And for example, we had a young patient, 16 years old, that experienced a CIED infection. No one would have thought that he would develop a CIED infection, but he did. And this was also a reason why we switched to every patient.
Thank you. You mentioned there that Tauropace doesn't do any harm, but we've had a couple of questions around side effects. Are there any known side effects for Tauropace?
Well, the active ingredients of Tauropace are well tested, and they're used in many fields of medicine today. And there has been reporting 1 in 20,000, so very, very rare cases of allergic reactions, which we have not encountered in the use of Tauropace. Instead, we get the feeling that the wounds are looking much better 2 or 3 days into after the surgery. So we have not seen any allergic reactions so far in a couple thousand patients, but there has been case reports when administered intravenously that there was mild allergic reactions to the active ingredients in these products containing similar active ingredients like Tauropace.
Thank you. We've had a couple of questions around Tauropace and whether or not it damages the CIED itself.
Well, clearly, Tauropace is CE certified, and it had to undergo safety and biocompatibility. So clearly, it's certified in this context. So you can use it in any CIED and will not damage the CIED. When you compare it to other solutions, for example, if you were to use any solution that is not designed to prevent CIED infection clearly or to be used on any CIED, and it were to damage the CIED, me as a doctor would be held responsible for using this because it's all off-label. Here, we're talking about on-label therapy regarding CIEDs and all components. This includes guide wires, sheath, introduction sheath, sleeves, suture, leads, boxes, everything. So you're clearly on the safe side when you use Tauropace because it is CE certified in this context, and the manufacturer would be held accountable if anything happens.
Great, thank you. The next one is, can you mix Tauropace with any other liquids?
I would not encourage this. I would suggest using Tauropace if anyone uses saline solution inside the pocket to flush out debris. Use Tauropace instead, because for one thing, if you were to mix Tauropace with saline solution, you are mixing, the Tauropace contains the active ingredients in maximum saturation, and you're lowering the saturation of the Tauropace solution, and therefore you're risking to have it not as active as you would want to have it. So you're lowering the percentage of active ingredients for one. So instead of using, if at all, you're using saline solution, which we never did, but it is encouraged in some centers, do not use it, but use Tauropace instead. And there's a risk if you were to use oxidizing agents, for instance, PVP iodine or something like this, together with Tauropace, does not go well. So it should not be used both inside the pocket. If you are doing antisepsis, outside skin antisepsis with PVP iodine or chlorhexidine, no worries, not a problem. Inside the pocket and on the CIED tauropase only.
Thank you. In the interest in time, we'll probably make this the last question, Benito. And it's, can you use tauropase with, together with Tyrex?
Actually, a colleague of mine in another center has used it in a patient that had relapsing infection all the time. They switched back and forth from one side to the other, subpectoral, subcutaneous, and so on and so forth. And they decided to use both in the pocket, which worked. I wouldn't encourage it because Tyrex is a polymer which is tyrosine based, and tauropase is degraded to an amino acid. And I don't know how the mesh and the active ingredients of tauropase are working together, or what would happen if they were be mixed. In that specific case, nothing happened, and they addressed it, or they addressed me with this matter after having done so. So it was too late to intervene from my side, but I wouldn't encourage it.
Okay, thank you, Benito. And a thank you for joining us today. It's been really interesting to listen to your work so far and the results that you have to date. And we look forward to finding out more. Thank you to everybody that's watching as well. If any of you would like to speak to Benito, if you'd like to find out more about Benito's work or tauropase, then you can use the contact us box below to drop us a message, and we'll come back to you. As I said before, any questions that we haven't addressed, again, we'll be reaching out to you after the webinar finishes today. We do have a number of other webinars in this series, so if you'd like to join us to find out more, 2 weeks from today, so Wednesday the 9th of June, again at 4 p.m, we'll be talking about the role of tauropase, or the application of tauropase with CIED box exchanges. So we look forward to perhaps seeing you then. But again, thank you, Benito, and thank you everybody for joining us today, and goodbye.
Thank you very much. Thank you very much. Bye-bye.
Thanks.